Listening Part B. You hear a junior doctor speaking with a patient in the cardiac clinic while a consultant is present. Now read the question.
Hello again, Mr. Waits. We met last week, didn't we? I've been telling my colleague here about you. I've seen the results of the tests, but there are just 1 or 2 points I'd like you to clarify for me and for the benefit of Dr. Granger. You did say that this pain and discomfort has troubled you for nearly 8 months and is getting worse?
That's right, Doctor.
Can I get you to describe the character of the pain? Or in other words, tell us what it is like exactly.
It's not always a pain as such. Often it's a feeling of discomfort in my chest, like someone's pressing down on it.
What about your breathing when you get the pain?
I don't notice any difference.
Now, what would happen if you and I and Dr. Granger here went for a walk up the hill to the station?
What's that now?
I just mean, if we were to walk, what do you think would happen? Do you think you could keep up with me if I walked fast?
Oh yes. Well, last summer I climbed up Ben Nevis in Scotland, so I've no problems there.
Listening Part B. You hear a senior nurse talking about removing sutures to a group of students. Now read the question.
When removing sutures, firstly put on your apron. If you have long hair, be sure that it is tied back securely. Explain to the patient that you're going to remove their sutures. They'll probably use the word stitches. Secondly, ask them if they're comfortable. They may ask if the procedure will hurt. Reassure the patient that removing sutures doesn't hurt. Third, perform hand hygiene. That means washing your hands thoroughly and drying with a paper towel. Then prepare your equipment, including some gauze, cleansing solution and stitch cutter on a sterile tray. Put your hand inside a sterile waste bag and use it like a glove to remove the bandage from the sutures. Turn the sterile bag inside out so that the bandage is now inside the bag. Put on your sterile gloves. Finally, look at each suture and check that inflammation has not occurred.
Listening Part B. You hear a staff nurse talking to a patient she is escorting to the radiology department. Now read the question.
Hi, Jake. It's time for your x-ray now. Are you ready?
Oh, okay.
Can you walk to the radiology department, do you think?
Is there a wheelchair or a walking stick maybe? I'm a bit weak this morning.
There's a wheelchair.
Oh, that'd be great, thanks.
Of course. Let me help you. There you are. Are you warm enough?
I'm a bit cold, actually.
Let me get you a blanket. There. Is that better?
Thanks.
And I just need to see your identity bracelet, please. Thanks. What's your full name?
Jake Peterson,
Your date of birth?
18th of January 1982.
Okay, thanks.
Listening Part B. You hear a nurse talking to a patient in the recovery unit. Now read the question.
Mrs. Wendell, can you hear me?
Yes.
I'm your recovery room nurse. Your heart bypass surgery went very well.
Oh, good.
I'm going to be taking your vital signs every 15 minutes and be checking your oxygen levels. The mask you're wearing will help with that. Can you breathe all right?
Yes, but my chest hurts.
On a scale of 1 to 10, with 1 being no pain at all and 10 being the worst pain, what number do you think your pain is right now?
Oh, I guess about 4 or 5.
Okay. And do you feel nauseous?
No, but I feel cold.
Listening Part B. You hear the beginning of a training session for doctors. Now read the question.
The function of the endocrine system is to regulate the various organs within the body, and it does this by using hormones, which are produced by glands. Today we are going to look at ways in which the endocrine system can malfunction and the effects that that can produce. I would like to begin by looking at the functioning of the thyroid gland. This is one of the largest glands in the body, and it is located in the neck below the mouth. It produces a number of hormones, the most important of which are T3 and T4.
Listening Part B. You hear a doctor talking to a nurse about a patient called Mr. Kransky. Now read the question.
Can you tell me how Mr. Kransky's doing?
Mr. Kransky? He's doing quite well, but he still has difficulty swallowing.
Has he seen the speech and language therapist yet?
Yes, he sees her every day to do tongue exercises to help his swallow reflex.
Well, that's good. What type of diet is he on now?
He started on a puree diet yesterday.
How's he managing with it?
He's managing it quite well.
What about the fluids?
He's still having thickened fluids and he's coping quite well with them.
Okay. Can he feed himself yet?
No, not yet. He still needs help.
Okay. I'll write up a referral to the OT.
Thanks. Maybe she can bring a few things to help him feed himself.
Right. Can you keep him on the puree diet and thickened fluids until his swallow reflex is better?
Sure.
I'll review him at the end of the week. Has he seen the speech and language